Let's start with this reminder. 2 weeks ago, Dr. Carter Abbott joined us to answer basic and advanced questions about Botox. We also saw Kayla. This was the day before she went to Omaha Med Spa to address a few areas of concern. Well, today, a live look at the results. Dr. Abbott and Kayla both return. It's good to see you again, Doctor. Kayla,
thank you for having me.
It's good to see you. Let's start with your Botox experience. What was it like?
It's really interesting because it's kind of the difference between going to see like your family doctor and going to see your hairdresser, like if you combined them, because you're talking about something that's medical, but it's also to enhance your looks and really to make you to feel good about yourself. So we looked very carefully at my face and talked about things and talked about how I felt about it, and then we just got it over with. It was pretty quick and easy, actually.
Okay, so for people who haven't had Botox before, one of the things they might worry about is how painful is it? So the sensation, how would you describe that?
It's a tiny little needle, and this is an area I had injections in my forehead and then on my crow's feet and then actually on my chin too. And I mean, obviously you can feel it. It's a tiny little prick, but I didn't need numbing cream or anything like that, and it was just over in a second. It was easier than giving blood, I will say that for sure.
And the redness, the bruising, sometimes patients will experience that. Did you?
A little bit of redness right afterwards. I did get one bruise, but it was really easy to cover with concealer, and it was gone in about 2 days.
How long before you saw the results?
I know that Dr. Abbott had told me some patients it can take up to a week, but I did start to notice improvement really in the next day or two.
And so overall, you're on a scale, let's say scale of 1 to 10, how satisfied are you with the results?
You know, what's really interesting is we did the injections right after we were on the show last time, and I would say I thought I was at an 8 or maybe a 9 at that point. But Dr. Abbott, it's really important to him to make sure that you're perfectly pleased and that he's checking his work too. It's not just about going in, getting injected, and come back and see me and get more injections. I went back in and we took a look, and there were a couple areas that I didn't realize that he could improve on even more. We did the injections for my crow's feet, and one side wasn't so now I'm like an 11. I was an 8 before, but
you're thrilled.
Going back in, I was just really impressed with the time that he took. And how much even better we were able to look things.
And Dr. Abbott, you say that's one. Other places do Botox, but the customer service, the satisfaction is what sets you apart.
Yes, I mean, we do over 1,000 treatments a year, so it's our #1 service.
Let's go through the before and afters so our viewers can see a little bit better where we started and where we are today. And would you take us through these?
You know, the before's on the left, after's on the right, and people will say, gosh, I don't see much of a difference, but that's the key. This is we're not changing Kayla's looks. We're not giving her a frozen face, a startled face. A lot of people have that concern. We're just enhancing how she looks.
So that's more of a rested face. She's not trying to express there.
Right.
Here she's trying to get those eyebrows closed in together, right?
So here's your classic 11s that she has on the left.
That I did not like.
And so we Botox that area. And I will tell you, she had 52 units, 23 different injections, 4 zones. So on the right, you can see she's trying to frown, but it's not happening, and the skin's nice and smooth, and it helps lift the brow up. Okay,
let's look at the next set of images here, where she's trying to lift her brows, and that's where we see those side-to-side lines in our foreheads that can develop. I mean, in our 20s, in some cases, you see them surface.
So on the left, the frontalis, we contract to raise our eyebrow, deep, deep furrows. We did only 8 units here. I'm always conservative. The right is the after, and she worked really hard to raise her brow. And this is actually an undesirable outcome, but it's easy to correct. So that's a spiking of her outer lateral brow, and we just tweak that by doing a couple extra units. And you can see today she looks wonderful.
That's what you were saying in that follow-up visit. That was one of the areas you were looking at to make sure she was perfectly pleased. I didn't realize before we started talking to you about Botox that you could use it to treat those lines outside the crow's feet.
Crow's feet.
So here you did that.
Yeah, and she doesn't have a lot of wrinkling. But there's before and after, and in the after on the right, she's working really hard to make those wrinkles, and there's very minimal. So that's a great result.
We have another set of images to show you here, and this is where
this is sort of a fun
aging
expression.
Brow face.
So this is exaggerated expression. This is on the left, making a pout. The lower lip rolls out, but the real feature here is that muscle in the chin, the mentalis, causes dimpling or an orange peel skin appearance. On the right, I've asked her to pout again, and it's nice and smooth and relaxed. In repose, the skin's very smooth.
I'd like to spend an extra minute on this idea that Botox makes you look frozen. It can if it's not done by a trained professional.
Yeah, I mean, you can get bad Botox, so you know, you shouldn't always shop just on price. You're not buying milk or bread. This is your face. So you do want to trust it to a professional who knows what they're doing.
And as you said, you took a conservative approach with Kayla because it was important to her that it still looked natural. And so
yeah, she looks great.
Yeah, I think so. Would you recommend it now if friends and family say, there's something different about you, I can't put my finger on it? Are you open about what you had done?
I'm open about it. I know that a lot of your customers are discreet and that you're willing to be discreet with them. For me, it's been really interesting because a lot of people have, like, since they knew that I did it, since I went on TV and talked about it, they've had a lot of questions. Does it hurt? What is it? Where did you have it done? You know, for me, it's like, well, I'm not going to lie about having my hair colored, so I'm fine to let people know about it. And it's been really fun because so many people are curious about it. I feel like I'm, you know, kind of out here just as an ambassador, maybe. So anybody who sees me, you can go ahead and ask me questions. I'm fine to talk about it. But I'm turning 40 next month. And I just went to a birthday party where friends of the birthday girl said, she can't be, she's not 40, she's 30. And they don't know why I looked that way. So, exactly. And I don't feel like I look 40.
Well, speaking, you've got that birthday coming.
That's
For our
right.
viewers who are watching now, Dr. Abbott presents this. For 30 days before or after your birthday, you can get Botox for just $9 a unit. Call to make your appointments or log on to omahamedspa.com. 2 locations now in our area. The original there at Eagle Run, but now in the Old Market at 10th and Farnham as well. Dr. Abbott, thank you.
Thanks, Mary.
It's always a pleasure. And Kayla, you look fabulous. Well, you did before, but I would say even better now.
Thank you.
Great results. Dr.